After the age of 60, most people believe that regular health checkups are the key to living longer and preventing diseases. Every year, millions of older adults across the US, Europe, and Asia line up at clinics, ready to undergo every test their doctors recommend. They believe that the sooner you know, the sooner you're safe. But there's a truth few people talk about. Many tests don't help you live longer. They can make you weaker, more fearful, and sometimes leave you with lifelong consequences. According to the American Geriatric Society, AGS, about 37% of medical tests in people over 60 lead to overtreatment, unnecessary surgery, or severe complications. Even worse, nearly 99% of older adults have no idea they're being overdiagnosed, meaning they are labeled as having a disease they don't truly have. Modern medicine is powerful, but not perfect. The more machines we use, the more abnormalities we find, even when they are harmless. The key question is not, do I have a disease, but if I know this, will it help me live better? Below are 10 medical tests that top experts in the US, UK, and Europe recommend avoiding after 60 if you have no clear symptoms. Each case comes with stories, research, and conclusions that you rarely hear in a doctor's office. Drop of blood 1. Full-body CT scan, when total screening causes total harm. Full-body CT scans were once advertised as the ultimate key to early cancer detection. A clinic in California once promoted. In just 15 minutes, you can see the condition of your entire body, from head to toe. Sounds appealing, but science says otherwise. Each CT scan exposes your body to 10 to 20 millisieverts of radiation, equal to about 500 chest X-rays. A 2023 study in JAMA Internal Medicine found that around 5% of new cancer cases in the US may be linked to unnecessary CT scans. In other words, 1 in 20 cancer cases could be a victim of testing. Marcus L., 69, a former martial arts coach in Arizona, learned this the hard way. He was healthy, didn't smoke, and felt fine. During a premium wellness program for wealthy seniors, he was urged to take a full-body CT scan. Result: a suspicious spot on his right lung. A biopsy was ordered. The spot turned out to be harmless tissue, but the biopsy collapsed his lung. He spent 12 days in the hospital, needed 2 months to recover, and never returned to teaching again. The American College of Radiology states, there is no evidence that full-body CT scanning increases life expectancy in people without symptoms. If you're healthy, only do a CT scan with a clear medical reason, such as unexplained weight loss, coughing blood, or abnormal findings from another test. A healthy body doesn't need radiation. It needs good sleep, balanced living, and peace of mind. Brain 2. Brain MRI. Forgetfulness isn't always a disease. At 60, forgetting a friend's name, misplacing keys, or wondering why you walked into a room is normal. But fear of memory loss, Alzheimer's, or dementia drives many older adults to get MRIs. MRI technology is amazing. It shows details down to a millimeter. The problem? It's too detailed. In older brains, small white spots often appear, perfectly normal, but they look alarming on scans. A 2021 study in Neurology Today followed 3,000 adults aged 70 to 85. 86% had abnormalities on MRI. Only 3% of those were linked to real disease needing treatment. That means 97% were frightened for nothing. George H., 74, a retired engineer from Oregon, fits this story. Worried because he often forgot his grandson's name, he took an MRI. Result: multiple white matter abnormalities. He panicked, stopped driving, stopped attending church. Later, a cognitive test, MMSE, showed normal results. His new doctor said simply, "George, that's not disease. That's age. And age doesn't need treatment." After 3 months of memory exercises, proper sleep, fatty fish meals, and daily walks, George's memory improved. He said, "I almost lost myself because of one picture." Conclusion: unless you have serious symptoms, seizures, personality changes, or rapid decline, MRI will only add anxiety. Geriatric doctors recommend starting with simple paper tests, MOCA, MMSE, safer, cheaper, and just as effective. Red Heart 3. Cardiac stress test, safety check, or diagnosis trap? A cardiac stress test measures heart activity while you walk on a treadmill or take a stimulating drug. Sounds useful, but in those over 60, it often causes false alarms. Older bodies react differently. Fluctuating blood pressure and variable heart rates create false positives. A 2017 JAMA cardiology study found a 40% false positive rate in adults over 60. That means 4 in 10 abnormal results come from healthy hearts. The outcome? Unnecessary angiograms, stents, lifelong medication, and kidney damage from contrast dye. Raymond T., 75, a retired mail carrier in Utah, only complained of fatigue when climbing hills. A stress test showed unclear results. He got a stent. Afterward, he developed kidney inflammation from the dye and stayed 6 days in the hospital. When he recovered, he still felt tired. Later, another doctor found he only had mild dehydration and anemia. If you have no chest pain, shortness of breath, or fainting, skip the stress test. Safer options: resting ECG, calcium score check, or simply healthy exercise, because a strong heart is one that moves naturally, not one forced to run on a machine. Bone 4. Bone density scan DEXA when weak bones aren't a disease. Bone loss is a normal part of aging, but the pharmaceutical industry turned it into a diagnosis. DEXA scans compare your bones to those of a healthy 30-year-old, so nearly all seniors appear osteopenic, low bone density. That label often leads to bisphosphonate drugs like Fosamax, Lindronate, which can cause esophagus irritation, acid reflux, and rarely jawbone necrosis when bone tissue dies from inside. A 2021 study in the Journal of the American Geriatric Society followed 1,200 women over 70. Bisphosphonates reduced fracture risk by only 0.3% in 5 years, but increased digestive problems tenfold. Rose M., 76, a piano teacher in Michigan, got a DEXA scan, low bone density. After 3 months on medication, she developed severe reflux and jaw pain, making her unable to play. Her geriatric doctor stopped the drug, prescribed resistance training, vitamin D, and sardines. A year later, she returned to teaching, healthy, no fractures. If you haven't fallen, fractured, or lost height quickly, skip DEXA scans. Walk, lift light weights, eat greens, and get natural calcium. That's how bones stay strong, without pills or machines. Pilapu 5. Colonoscopy, when prevention becomes surgery. Colonoscopy saves lives, but after 60, the risks rise sharply. Preparation requires fasting, strong laxatives, and anesthesia, a heavy toll on older bodies. A 2019 JAMA internal medicine study on 1.3 million Medicare patients found. Among 1,000 adults over 75, only 2 lives were saved. But 20 experienced major complications: bowel perforation, bleeding, arrhythmia. Dana R., 73, a bakery owner in Ohio, had no symptoms, but was told to check just to be safe. During polyp removal, her colon was punctured. She spent 9 days in the hospital and lost 5 kilograms. Her 2 previous colonoscopies had been normal. The U.S. Preventive Services Task Force, USPSTF, advises: stop routine colonoscopy screening at 75 unless you have symptoms or family history. DNA 6. PSA prostate test, when early detection becomes early punishment. For decades, the PSA, prostate-specific antigen, blood test was considered a male lifesaver. But in men over 70, it often harms more than it helps. Why? PSA can rise for many harmless reasons: prostate enlargement, inflammation, even cycling or sexual activity. So, a high PSA doesn't necessarily mean cancer. A 2020 Harvard Medical School study showed over 60% of men over 70 have high PSA, but only 3% have cancers needing treatment. Once PSA is high, the cascade begins: Biopsy surgery complications. John S., 72, a retired PE teacher from Boston, recalls. They said I had early-stage prostate cancer. I panicked and agreed to surgery. Afterward, I lost urinary control and sexual function. 3 years later, another doctor said my cancer was the slow-growing type. Surgery wasn't needed. According to the American Cancer Society, prostate cancer in men over 70 usually grows so slowly that most die with it, not from it. So at 60 plus, focus on quality of life, not PSA numbers. If you have symptoms, frequent urination, burning, weak stream, simple urine or ultrasound tests are safer than yearly PSA screening. Face 7. Routine chest X-ray. A clean image doesn't mean safety. Chest X-rays once symbolized good health screening. Yet long-term studies show almost no benefit for non-smokers over 60. The U.S. National Lung Screening Trial found routine chest X-rays do not reduce lung cancer deaths in non-smokers. Why? X-rays detect tiny shadows or nodules. Most are harmless scars. Then come more CT scans, biopsies, or even surgery, risks greater than the spot itself. Richard H., 78, retired in Minnesota, took yearly chest X-rays. One showed a small shadow CT, possible cancer biopsy. Result: it was an old scar from pneumonia decades ago. But the biopsy collapsed his lung. He spent 6 weeks in bed. He said, I spent 6 weeks suffering over a scar that didn't matter. Science says, if you quit smoking over 15 years ago or never smoked, skip routine X-rays. If you still smoke or have persistent cough, ask about low-dose CT, only if medically indicated. 8. Carotid artery ultrasound, stroke prevention that can cause surgery. Luxury clinics often sell carotid ultrasound for early stroke prevention. Sounds smart, but major medical centers, Mayo, Cleveland Clinic, USPSTF, disagree for people without symptoms. In seniors, small plaques in carotid arteries are common and harmless. Ultrasound may find 40 to 50% narrowing, not dangerous. Yet, that often leads to unnecessary stent or surgery, which can cause real strokes. A 2019 JAMA study found, among 1,000 symptom-free adults over 70, 87% false positives. 15% underwent needless procedures, risking real strokes. Helen G., 79, Illinois, had normal blood pressure. Her daughter booked a stroke check. Result: 50% narrowing stent placed a plaque dislodged mild stroke. She couldn't speak for 2 months. Later, another doctor said, with that level of narrowing, you didn't need surgery. Just control blood pressure and cholesterol. If you have no neurological symptoms, blurred vision, weakness, dizziness, skip carotid scans. Walk daily, eat greens, and manage cholesterol. That's true stroke prevention. Petri dish 9. Thyroid ultrasound, when a benign nodule becomes a reason for surgery. Thyroid ultrasounds became trendy as doctors began finding tiny neck nodules. But in older adults, most are benign and harmless. A 2018 New England Journal of Medicine report stated, over 90% of thyroid nodules detected by ultrasound in older adults do not grow or need treatment. Still, once a nodule is seen, fear leads to surgery. Thyroid surgery in seniors is risky. It can damage vocal cords, lower calcium levels, and cause lifelong hypothyroidism. Eleanor D., 80, Vermont, had a checkup ultrasound showing a 0.8 centimeters possibly malignant nodule. She had full thyroid removal. Result: benign. But her voice became hoarse, and she must take hormone pills forever. She said, I lost my voice over something that never threatened me. Mayo Clinic advice: don't do thyroid ultrasounds unless you feel a lump or have symptoms, difficulty swallowing, voice changes, swelling. If a nodule is under 1 centimeter, monitor with imaging instead of immediate surgery. Brain 10. Ovarian cancer screening, peace of mind, that steals peace. Among overused women's tests, ovarian cancer screening, ultrasound or CA, 125 blood test, is the worst example. Many women over 60 think it's mandatory, but nearly every major health organization warns against it. The U.S. Preventive Services Task Force, USPSTF, states, there is no evidence that ovarian cancer screening in asymptomatic women lowers death rates. Instead, it produces false alarms, leading to unnecessary removal of ovaries and uterus, harming body and mind. The UK Collaborative Trial of Ovarian Cancer Screening, UCTOX 2021, followed 200,000 women over 60 for 16 years. No difference in death rates between screened and unscreened groups, but twice as many unnecessary surgeries in the screened group. Margaret F., 74, Manchester, had normal health. Her CA 125 rose slightly. Ultrasound showed a 1.2 centimeters suspected mass. She underwent full hysterectomy. Results: no cancer. She spent 3 months recovering, suffered hormone loss and insomnia. She said, I wanted peace of mind, but lost my peace instead. If you have no symptoms, bloating, sudden weight loss, pelvic pain, skip ovarian screening. Instead, do regular gynecologic checkups when indicated and stay calm. Conclusion: less, but smarter. Modern medicine has helped us live longer, but it also made us overly dependent on machines, numbers, and fear. After 60, we don't need to scan every inch. We need to listen to our bodies. Harvard Health Publishing summarizes it best. The difference between living long and living well lies in knowing when to say, that's enough. Many tests don't prevent illness. They only make you live in fear of it. True prevention means person running, move daily. 30 minutes of walking lowers heart disease risk by 40%. Broccoli, eat smart. Fish, greens, less sugar. Sleeping face, sleep well. 7 to 8 hours nightly cuts dementia risk by 25%. Handshake, stay connected. Friendship, laughter, sharing, the strongest free medicine for aging. Stethoscope, test wisely. Only when symptoms or clear medical reasons exist, and always ask your doctor. If this test is abnormal, what's the next step? Will it really help me live better? Blossom final note. Turning 60 is a gift, not a warning. Your body has worked tirelessly for decades to keep you here. It deserves respect, not fear. Care for it with understanding, calm, and trust. Because sometimes, doing fewer tests is the smartest way to live longer and happier. Would you like me to make this translation suitable for a spoken narration, e.g., calm, storytelling tone for seniors' YouTube audiences? I can adjust it into a 10-minute video script with natural pauses and warm delivery.